here's a question for you, Eric, involving potentially a pregnant woman who has coronavirus, but is otherwise well and may have very mild symptoms. Should a person like this be receiving blood thinners during their pregnancy? And what about after their delivery? And again, recognizing that for those people out there who are pregnant or planning to have a child, it's a very stressful circumstance at best. And should they be concerned about thrombosis? What do you think, Eric?
Thanks, Jim. So as Jim mentioned, this is a challenging time to be pregnant, go through prenatal care, and coming to the hospital for delivery. The situation we're talking about is a routine pregnancy in someone with a mild COVID-19 infection, but otherwise well with no previous history of clotting. If you are pregnant and you do develop a mild COVID-19 infections, in most cases, the risk of blood clotting remains low, and blood thinning medication will not be recommended before delivery or after delivery. A couple caveats to that statement. The first would be that if you do have a previous history of thrombosis, then your risk would be higher than other people if you do develop COVID-19. And certainly you'd want to speak with your doctors about whether providing blood thinners before delivery would be advisable. And then certainly after delivery, when the risk of thrombosis is highest in the first 6 weeks postpartum, you'd want to have that discussion with them as well if you do develop COVID-19 infection. The second sort of caveat to that statement is at the time of delivery, when pregnant women are admitted to hospital for a routine vaginal delivery or C-section, the medical team may discuss with you about receiving preventative blood thinners while you're in hospital after delivery, but not after you're discharged if you do have COVID-19 infection. So that's something to keep in mind, and that's something that may be discussed with you while you're admitted for that brief period for your delivery. The other thing to keep in mind is, most of the time, vaginal delivery, C-section is routine. Occasionally, there are issues that can happen during delivery or afterwards that can also affect your risk of clotting as well. And so that's something you should speak with your healthcare providers about too.
Thank you, Eric.